you can think about the content. Also, obesity is a hot topic, but you can just think about the lecture style, how I made it. Obesity represents a major health issue with the estimate suggesting that more than 1/3 of the world population are affected. Bariatric surgical procedures, including sleeve, gastrectomy, and the Roux-en-Y gastric bypass, and laparoscopic gastric bending, and the laparoscopic sleeve gastroplasty are effective, but less than 1% of obese patients receive surgery every year because of high cost and adverse event. Dr. Hwang Jin-shi, you are not doing bariatric surgery, right? Who do bariatric surgery in your hospital?
Like obesity.
Yeah, obesity.
No, our hospital.
Nobody does.
Yeah,
because this is cancer.
Yeah, but I know this type of the surgery.
Okay.
Well, I in the USA, I see many of these type of.
Yes. Actually, in the United States, it's a hot topic because there are lots of patients with obesity in the United States. What about in China? What percentage of people are obese in China? Do you know?
Sorry.
You don't know. Anyone knows? In Korea, actually, the patient with obesity are increasing all the time because of the westernized food. Also, they don't exercise. That's why on the street, it's difficult to see that obese patients. But in hospital, as a medical center, big guys. And then also, they stay at home. In the United States, that's interesting. The obese patients are more popular in the United States than in Europe. They say that because of the lack of exercise. And also in San Antonio, there are lots of obese patients. And also, it's okay for them to walk on the street, go to market any place in the United States. But in Korea, they don't like go outside because they are ashamed. That's why they stay at home. That's a big problem. That's why the bariatric surgery is very important. But please remember that less than 1% of obese patients receive surgery because of the high cost. It's very expensive and also side effect.
肥胖问题是一个重大的健康问题，估计有超过全球1/3的人口受到影响。诸如袖状胃切除术、Roux-en-Y 胃旁路术、腹腔镜可调节胃袋术以及腹腔镜胃袖成形术等减肥手术是有效的，但由于高昂的费用和不良事件，每年只有不到1%的肥胖患者接受手术。
Dr. Shishijin, can you understand? But anyway, this is a stomach, right? The food, they try to make a small stomach because if the stomach is small, they cannot eat a lot. That's why this is a kind of a surgery. And also this is when they just dissect stomach here and there, and also this is a bend so that they can have less food. This is different kind of method. So here you can see the laparoscopic Roux-en-Y gastric bypass and the laparoscopic sleeve gastroplasty result in 30 to 35% of total weight loss. So surgery is popular now.
在这里，您可以看到腹腔镜 Roux-en-Y 胃旁路数和腹腔镜袖状胃成形术，可以导致总体体重减轻30%至36%。
Here you can see the courtesy of Dr. Hani Share. Do you know the meaning of courtesy? How many of you know? Any volunteer to explain what does courtesy means? Dr. Yuan, you know, right? What does it mean?
This means this picture from Dr. Hani Shahab, and he allowed you use this picture.
Yeah, yes. So that means a courtesy is from. The slide is from Dr. Hani Share because I asked him to send me some slide. That's why he's an internal medicine doctor because he gave an excellent lecture. That's why I asked him to share some of his slide with me. So it's important to address the courtesy of Dr. Hanisheb or something like that. I know that some of you use my slide. It's okay because every time I upload my slide, it's okay to use my slide. But please address courtesy of Professor Ho Young-sung, because if you don't use this kind of message at the bottom, they believe that it is from you. So some people believe that, oh, that is a Professor Song. It's not good idea to use without any this kind of sign. Don't forget, this is very important. Also, it is same. If you want to use slide from Dr. Shishijun, it's okay. And you can use this one. But the best thing is that you can ask Dr. Shi, can I use your slide? It's much better. Without any permission. If Shishijun does not allow you, don't use it. So because this is more and more important in China. Long time ago, it was okay in Korea, but they can sue in the United States. If they use without any their permission, even their photos, they sue you. You lose lots of money. So this is very important.
顺便问一下，你知道这张幻灯片底部写着的 "Courtesy of Dr. 哈尼西哈布"是什么意思吗？这意味着我从哈尼西哈布博士那里得到了这张幻灯片，并获得了使用的许可。我知道我的一些学员使用我的幻灯片，这完全没有问题。但请在你的幻灯片上标明 "Courtesy of Professor Hong Yong-song" 以示归属。
Okay. Endoscopic therapies for treating obesity, such as intragastric balloon placement and duodeno-jejunal sleeve bypass and endoscopic sleeve gastroplasty have been extensively studied for fulfilling the growing unmet needs for weight management. As you know, surgery, as I mentioned, less than 1% of the obese patients go to surgery. That's why endoscopists, even interventional radiologists, they want to develop some device for treating obese. It is same. They want minimally invasive treatment. That's why recently the laparoscopic surgery is more popular than open surgery.
用于治疗肥胖的内窥镜疗法，包括胃内球囊植入、12指肠空肠旁路套管以及内窥镜下袖状胃成形术，已经得到广泛研究，以满足不断增长的体重管理需求。
Okay. Anyway, this is a very interesting movie showing the sleep gastroplasty. There is a laparoscopic sleep gastroplasty and endoscope. This is an endoscopic sleep gastroplasty.
这是一个展示内窥镜下袖状胃成形术的动画。
The endoscopic sleeve gastroplasty is a non-invasive endoscopic procedure designed to reduce gastric volume. This animation provides an overview of the latest technique. A coagulation device, such as the argon plasma coagulator, is used to mark the anterior and posterior walls of the stomach along the greater curve. This creates a guideline for the first outer row of sutures. The first row of full-thickness stitches is placed from distal to proximal. A running triangular suture pattern alternates from anterior wall, greater curve, posterior wall, and is repeated for 5 to 6 bites. The anchor is then released and the stitching sequence is cinched tight. The triangular pattern is repeated. A total of 5 to 6 triangular running stitches are repeated in this first row. This suture pattern is designed to maximize the reduction in stomach volume and foreshorten the greater curve. A secondary inner row of interrupted or running stitches is placed following the lesser curve to create the sleeve effect. These plications extend up to the gastroesophageal junction just below the Z-line.
So I know that you sent Dr. Xiaowei Li and Zhao Ke to learn endoscopy and bronchoscopy, right? Right? So Professor Cheng Tao, you don't know how to do endoscopy, right? Yes, Michael. Why do you want them to learn?
No, I didn't first think about learn this technique, but as you mentioned, Dr. Zhao and Dr. Xia has already gone to Beijing and Shanghai to learn bronchoscopy and endoscopy, but I didn't.
So
I can't do this.
do you think it's important for interventional radiologists to learn endoscope?
Yes, I think it's really useful for us, especially for the enterology intervention procedures, such as feeding tube or gastric or intestinal stint is useful for this kind of procedure.
Okay. And it is controversial, actually. In the world, the United Kingdom, interventional radiologists, they can do endoscope, and they can do interventional radiology. Actually, the interventional radiologists are more skillful than endoscopists. That's why the interventional radiology in the UK is very strong, particularly GI tract, because they can do endoscopic procedures and also interventional procedures. In South America, surgeons, they do interventional procedures. There are no interventional radiologists. There are interventional surgeons. That's why it is different from country to country. But in Korea, I didn't want to learn endoscopies because I was busy to do my own work. So it is different from hospital to hospital. But in my case, I like a collaboration. So even though I can do some endoscopic surgery, they are better than I am. That's why I can learn. Of course, if I learn endoscopy, probably 1 month is good enough. But if I learn endoscopy, I cannot do any interventional procedures. But that's why it is controversial. So it will be different from hospital to hospital. But endoscopy has lots of advantages. Anyway, Dr. Wugang, do you know how to do bronchoscopy? 你会做 bronchoscopy 气管气管镜 Okay. Anyway, so in summary, bariatric surgery is the gold standard. You know the gold standard, but less than 1% of obese population go to surgery. And exercise is least risky for treating obesity, but less than 5% of obese population can see the effect. This is the problem. Anyway, this is not my experience, right? This is their experience. So it belongs to 30%. That means I have 70% more to introduce my experience.
总结一下，减肥手术是黄金标准，但不到1%的肥胖人口接受手术，而锻炼对于治疗肥胖来说风险最小，但不到5%的肥胖人口可以看到效果。外科医生们不必担忧，因为内窥镜疗法远远无法模仿手术效果。
Okay. Now I introduce the surgical treatment, but I want to connect the current research to my research. That's why I added some slides, including interventional procedures. The stomach plays an important role in obesity, gut-brain signaling, and endocrine function, ghrelin. Ghrelin is important. You can memorize what is ghrelin. This is hunger hormone. So the obese patient has lots of ghrelin. That's why they want to eat. To reduce the ghrelin level, the left gastric artery embolization for bariatric intervention has been attempted, including 6 studies of 47 patients, but with only 8.2% total weight loss. In addition, ghrelin levels get back to normal after 6 to 9 months. Dr. Chong Tao, you know, this is a left gastric artery, right? So, have you ever read this article on bariatric left gastric artery embolization?
Yes.
You read it?
We did many cases of left gastric artery embolization.
For hepatocellular carcinoma,
yeah,
right?
Sometimes for gastric cancer and sometimes for bleeding.
But this is for obese patients.
No, we never do this.
So there are only 6 studies, not from China. It's from European countries. I read it, and they're from United States. And then, anyway, they occluded the left gastric artery to decrease the ghrelin level. So if you do lots of embolization of left gastric artery, probably this is very interesting. You can check ghrelin level. You can check their body weight after embolization. But anyway, there is something new. If you can ask Lian or to write a paper. If you have many cases, probably, but anyway, it should be prospective study, not retrospective study, because they didn't check ghrelin level. You have to check ghrelin. This is hormone level. And then body weight. So if you want, you can read this one and then write a paper. If you are interested, if not, just ignore it.
胃在肥胖、肠脑信号传导、胃动力和内分泌功能中起着重要作用。为了降低胃饥饿素水平，包括47名患者的6项研究曾尝试过左胃动脉的减肥栓塞，但总体体重减轻仅为 8.2%。此外，胃饥饿素水平在6至9个月后往往趋于恢复正常。
Also, Dr. Chen Chengxi, have you ever done left gastric artery embolization?
As Professor Chen said, yes, we do. We embolize the artery, but we don't do it for obesity patient.
So anyway,
Cancer patient.
can I ask how many cases do you do a year left gastric artery embolization?
Maybe 20.
20 cases a year
Yes.
total, right? 20 cases a year.
Maybe not total. Only
Yourself.
myself, yes.
So can you tell how many cases a year?
Not too many. I think maybe about 10.
So Chen Chengxi, 20 cases, you 10 cases.
No, I think it's totally in our departments is 10 to 20, not too many.
In a year, it's
Yeah,
not
yeah.
many. But it's okay. 10 cases will be okay if you really want to write a paper. It will be accepted by JVIR. It is easy.
Yes, but even in the past, professors who have suggested one daughter try to collect some data about this kind of patient. Maybe Gengxiang? Yes.
No.
As I remember, yes, they have in the past. Maybe they have collect some data. Because we do this kind of embolization, it is also special.
So my idea is different. So past you did for other patients,
Cancer, yes.
but you didn't check ghrelin level. You didn't check body weight.
Yes.
So you have to make a prospective study from tomorrow or from next month. Just include 10 patients, it will be accepted. This is very simple because you are doing left gastric artery embolization, right? And then you can read this article. So make a prospective study. You can give it to Dr. Ian or Gongxiang, anybody.
Yes, it's a good
It
idea.
will be very easy to write a paper because this is a prospective study. We have reviewed many papers, but this will be the better than previous one. Or Chenyao, you can start if you are interested. It will be accepted, I guarantee. But anyway, this is my idea. So, unpublished human data of the full sense device has shown 28% total weight loss in 46 days. However, its clinical or experimental data in the literature are scarce. Do you know this one? Similar to my previous lecture, right? Anybody? Zhang Hao. What does it look like?
I think it's look like I don't know how to. Can I say Chinese? Speak Chinese?
Yes.
漏斗.
Yuan, what does it look like? I gave talks many times.
It looks esophageal stent.
Yes, it looks like 食管支架，像食管支架。我给你岩浆。食管支架。This is very similar to esophageal stent. Actually, I developed this curved stent for the first time in the world, right? 1991. After that, they modified all the stent a lot. So anyway, they modified my design. This is all my design actually, but it's okay. So this is a modified esophageal stent, which is tapered end located in the gastric cardia. It is different because my stent didn't have this kind of flask. They attached it so that they placed the flask in the gastric cardia. Why? Because ghrelin produced in the gastric cardia. You can
未发
listen.
表的 Fossens 设备的人体数据显示，在46天内，体重减轻了28%。然而，有关其临床或实验数据的文献资料稀缺。它是一种改良的自膨式食道支架，具有扩张的末端，安置在贲门，以诱导饱腹感。
Dr. Yuanang, you have already applied for grant, right? With this topic.
Yes.
You have to understand the basics. Otherwise, it cannot be successful. Anyway, they placed gastric into the gastric cardia, the flask type. Do you know why?
Yeah, yes. It can catch the fundus and prevent the hormone.
Ghrelin, how it is possible? So anyway, you can see that. So they feel some feelings of fullness. If, for example, if you put endoscopists use the balloon, they press the balloon into the stomach, right? So if they have a balloon in the stomach, they feel, oh, my stomach is full. It is the same. So it is in the cardia, so they feel fullness. Another one is that cardia produce ghrelin hormone a lot. That's why I'll give it. This is a very interesting idea, but they tried multi-center study in the United States. So I have been waiting for the result, but there have been no report. I wonder why. Because it's a rumor, it's not true. Some patient died because of this procedure, so it was abandoned. So anyway, it was very interesting article. That's why here you can see the ghrelin. Don't forget, today you can think about obesity. Ghrelin is equal hormone. Ghrelin is known as a hunger hormone. Hunger hormone means that if you are hungry, ghrelin level is high. You want to eat something. That's why the obese patient, they feel hunger because the ghrelin level is higher. And the full sense device, this is full sense device, is a minimally invasive approach to induce satiety. Satiety is a fullness by continuously pressing the stomach and stimulating ghrelin producing cells. Again, the cardia, they say that this is a theory, has a lot of ghrelin producing cells.
胃饥饿素是一种食欲激素和多功能的肠道激素，它能激活生长激素促分泌素受体。胃饥饿信号在增加食物摄入方面起着重要作用。饱腹感设备是一种微创方法，通过持续压迫胃并刺激产生胃饥饿素的细胞来诱导饱腹感。
Okay, now I am going to introduce our experience. So that was 30%. Actually, 20% were related with the surgery, 10% related with the endoscopic, like a full sense device, left gastric artery embolization, related with my field. So I'd like to introduce our experience with intragastric satiety-inducing device in porcine model. This is not clinical experience. This is an animal study. That's why, Dr. Yuanang, if you want, you can do a similar experimental study, but anyway, there are lots of problems. That's why you can learn.
我想要介绍我们在猪模型中使用胃内饱腹感设备 ISD 的经验。
To overcome the pitfalls related with the full sense device, we developed the 3 types of ISDs, 2 curved ones and 1 bare one, and evaluated the feasibility, safety, and efficacy in a porcine model. So if you want to design some device, it's important to do animal studies first, and then apply for clinical studies. So the stent part were 24 millimeters, and then it was 60 millimeters long, and this is the presque part of the curved ones and the bare ones. So the devices had 6 flaps to prevent migration. And also top B had 4 barbs to prevent stent migration.
为了克服与饱腹感设备相关的缺点，我们开发了3种食管胃饱腹感设备，包括2种腹模型和1种类似于饱腹感设备的无腹模型设备，并在猪模型中评估了这些设备的技术可行性、安全性和有效性。这些设备的支架部分直径为24毫米，长度为60毫米。这是腹模型设备的盘部分，这是无腹模型设备的盘部分，它们直径为7毫米。通过一根镍钛合金线和一根尼龙绳连接在支架部分。所有类型都有4个防迁移翼 ，B 型还有6个倒刺。
Okay, any questions or comment? If not, a total of 9 peaks were used for study, 3 for control and 6 for device group. So in the device group, first type A, this is type A device was placed. In case of migration, we removed the migrate device under endoscopic and laparoscopic guidance and placed either type B or type C. So this is minor. Here you can see migration in a pig and removed it.
本研究使用了总共9头幼年猪，其中3头作为对照组，6头作为 ISD 组。我们将这些猪分成了2组，3头用于对照组，6头用于设备组。B 组使用 9.3 毫米传送系统安装 A 型 ISD， 如果 ISD 发生迁移，我们会在内窥镜和透视引导下将 ISD 取出，然后随机安装 B 型或 C 型 ISD。
Okay, as for the follow-up studies, we performed monitoring their food, everyday food, and the ghrelin hormone. Again, this is very important, ghrelin hormone levels. And plain radiograph in ISD group and endoscopics 8 weeks after placement. And all animals were sacrificed 12 weeks, 3 months after placement.
随访研究包括每天监测它们的食物摄入量、体重变化和胃饥饿素水平，每周进行普通 X 光检查，以及在 ISD 组置入后8周进行内窥镜检查。所有动物在开始实验后12周被处死，进行大体和纤维镜检查。
Okay, this is a flow diagram showing the result. So type A device was placed successfully in all animals, but all device migrate downward within a week, migration, EWA. So the migrate device was removed endoscopically and laparoscopically, and the type B device was placed in 3 and type C in other 3. So all the devices migrate again within a week, except the one. This is very interesting. So one bear type did not migrate. So the animal with no migration and 3 animals for control group were sacrificed 12 weeks follow-up study.
这是一个显示结果的流程图。所有猪的 A 型设备植入在技术上都取得了成功，但所有设备在1周内都移位到了胃内，在内窥镜和透视引导下移除。没有并发症，在发生支架移位的猪中安装了 B 型或 C 型 ISD， 除了1台 C 型设备外，其余所有设备都在1周内迁移到了胃内。没有发生设备迁移的那头猪以及对照组的3头猪在实验结束后12周被处死。
So here you can see it was published in obesity surgery. So the negative result, right? So Dr. Park is a radiation technologist. Now he's PhD, and also Dr. Nader from Egypt. Later, I will introduce who is Dr. Nader, who is Dr. Park. Both of them are my mentee. At the end of this year's mentoring program, review of the mentoring program. At that time, I'll introduce Dr. Nader. He stayed with me for 3 years, like Dr. Chow, and he is GI physician. But from the beginning, he said that there is nothing to learn from you because you are interventional radiologist. I am a internal medicine, but his boss sent it to me. That's why, okay, you can stay with me for 6 months. And after that, he decided to stay with me for 3 years. And his dream was to go to the UK because the situation in Egypt for doctors is not good. But I talked to him, you can go to the United States instead of UK. I explained many regions. And then he moved to the United States. Now he became a professor. The day before yesterday, I received him. Every time he sent me email, it's a wonderful history, like Dr. Chow. Anyway, at the end of this year, I will show his history to share with you. So here you can see severe tissue hyperplasia through the mesh, and then the disc part was in contact. So anyway, it was published in Obesity Surgery, but I talked to him, please write a paper. He said, no, this is just one case did not migrate, but you can report even the negative result. But it was accepted by obesity surgery. So every time you don't need to report the excellent result. If the result is not good, if it's something new, it's okay to publish, okay? This is the one thing that you can learn from his experience, okay? We can have a 5-minute break, and these 3 types have some problem. What are you going to do? I will ask the question after 5-minute break. Everybody can prepare. What can I do to solve the problem?
在这里，您可以看到 C 型 IST 食管部分的网格上出现了严重的组织增生，盘部分与胃底接触。
OK， 5分钟休息。休息동안你看到怎么防止这个的并发症 ？OK， Dr. Zhang Zhongyang, how would you solve the problem? You know what is the problem? So the guys who are interested in research should think about.
I think the most important problem is the migration of this stent. So I think whether is it possible to add more bulbs or some other anti-migration, like we can use add more anti-migration flaps or bulbs.
Okay, Chenyao. Because when you have some problem, again, this is a perfect time for you to develop a new idea. So every time I have encountered with the difficult cases or complications, that was a perfect time to develop ideas. So Chenyao, what's your idea?
We can launch some drugs in the skin.
What's the problem now? As Zhang Dongyang mentioned, the device related with this covered and bed one was migration. Migration rate was 80%, right? How can you solve? If you use drugs, can you prevent?
We can eat some drug, some barb.
Bob?
Yes.
You talk about bobs. Okay, Shishun. Think about it. There is no answer. So
I just think about how to change some part of this kind of stent.
how can you change?
Because I noticed the upper structure of the stent is
Straight.
with two bars. So how about make some stent
shoulders
突出就是out of the street stent to enlarge some part of the
Okay.
stent.
Flaring or shoulder.
Yeah.
Okay. Ro Yenin, do you have any idea? Surgeons, Huang Jinxi, and after her is a GI after Ro Nian.
Could we
Yeah, I agree with. Yeah, we should change another type of the stent.
But different idea. Okay, Huang Jianxi, do you have a different idea? Anti-mobbing is okay, and flaring is okay. Any other idea?
could we have a line to brown with nose?
Line.
Yeah.
Oh, that's good idea. Oh, okay. So any other? 岳小群、岳小鱼。Breast surgeon, what are you going to do to solve the problem? We have this kind of problem a lot in clinical work, right?
Right.
No idea. So if you have any idea, please let me know. So again, when you encounter some complications, don't lose the opportunity. You have to solve the problem because currently available treatment is not the perfect one. You can think of every time you can think about question mark. What can I do to solve this problem? You can solve the problem. That was a perfect time. But many doctors, they are afraid of making complication. Nobody wants to make complication, but it is inevitable. So anyway, that was perfect time for me to think about how can I solve the problem? How can I? So we devised a new design, like Zhang Dongyang, as mentioned, we had also more bulbs here, 6 bulbs, and also anti-migration flaps. And also, because we put in the esophageal junction, it needed a valve, anti-reflux valve. Like Huang Jinxi, it's an excellent idea. Because I read this article from 100 years ago, a doctor, thoracic surgeon, used some kind of string to prevent migration. So anyway, we use this one. I will show you.
在有经验之后，我们开发了一种新的 ISD， 以克服与先前版本的 ISD 相关的缺点。新的 ISD 的最上部没有腹膜，包含一个拉绳以便移除。它具有4个防移位翼和6个倒刺，在支架的远端，长度为2毫米，以帮助固定在食管上，抗反流阀、2根支架线和一个盘部分。
천양, Bob's, Daozi. One way we pronounce Daozi, right? Okay. So you can see 8 animals were used for this study, 5 for device group and 3 to control group. To prevent migration, the ISD was fixed in place by 2 strings, like Hwang Jin-shi mentioned here, and then tied to the pig's snout. No, snout is nose, right? So 2 strings, and then through the nose and snout to prevent. It is very crude, but we have thought about a different kind of method because Bobs, there are limitations. Every time, even though we had 12 Bobs, it migrated. So Dr. Chao Jiawei, they used the suture. They made the suture here. Because this is the animal suture, but eventually it migrated. It was okay for the first or 3 weeks. After that, it was because even though they use a suture, it can peel out from the mucosa. That's why there is limitation. But anyway, there are different kind of method. Also, his report was published. So the 4 of 5 ISD group and 2 of control group sacrificed 6 weeks after placement, and the other 2 animals were sacrificed 10 weeks after starting experiment. And in the 1 ISD pig, the ISD was removed 6 weeks after placement and followed up for 4 weeks. This is very important for animal study to check rebound effect.
本研究使用了总共8头幼年猪 ，ISD 组接受了新的 ISD， 而3头体重和年龄相匹配的猪被用作对照组。为了防止迁移， ISD 通过2根绳子固定在原地，并使用 3D 建模制作的锚定工具系在猪的鼻子上。5头 ISD 组中的4头和3头对照组中的2头，在实验开始后6周被处死，剩下的2头猪在实验开始后10周被处死。在其中1头 ISD 组中的猪中， ISD 在植入后6周被移除，并在处死前进行了4周的随访，以检查是否有任何反弹效应。
And this is plain retroradiographs obtained immediately after, and 2 weeks, and 4 weeks, and 6 weeks after placement. The device is placed in place with no migration because you know that this is snout.
这些是在 ISD 植入后立即2周、4周和6周后获得的侧面普通 X 射线照片。ISD 保持在原位，没有移位。
The ISD group had a significantly lower median % of total body weight gain from the first week to 6th weeks, and this is a rebound. Rebound pig showed a higher % of total body weight gain from the 7th week.
ISD 植入的技术成功率为100%。ISD 猪中有2头在植入后4周和5周发生移位，原因是绳子的分解。ISD 组总体体重变化百分比的中位数从第1周到第6周明显低于对照组。反弹的猪显示出从第7周到第10周的总体体重变化百分比高于对照组的猪。
So anyway, there is also limitation. The previous design was migration rate was 80%. Now 40% still migration. Even though we used the strings, there was a disintegration because the pigs, they don't like that kind of strings. Regarding again, ghrelin hormone level was lower in ISD group than in control group.
至于4头猪的胃饥饿素激素水平 ，ISD 组的平均水平低于对照组。来自2头 ISD 移位的猪和另外2头猪的样本没有被分析。最终，其他4头猪的血样被分析，对照组等于2， ISD 组等于2。
This is also very interesting photo. Showing the growth findings after sacrifice in an ISD group. So this is an empty stomach, right? And this is a filling with the water. And then you can see a prominent ISD in place while the stomach is empty. That's why this is cardiac. The patient or pig filled fully because it is filled with this device, and also it decreases secretion of ghrelin, and also tissue hyperplasia.
这张幻灯片展示了在1头 ISD 猪被处死后的总体观察结果。在这里，您可以明显的看到 ISD 位于原位，而胃是空的。当胃充满水时， ISD 变得不那么明显。由于 ISD 食管远端出现了严重的肉芽组织形成。
So you can see the difference between ISD group and the rebound pig. A lot of tissue hyperplasia and inflammatory reactions in ISD group.
关于组织病理学的发现，您可以看到与对照组和反弹猪相比， ISD 组中出现了明显的组织增生，上排以蓝色表示，和黏膜下层的炎症紧润，中排箭头。在食管胃交界处，您可以看到 ISD 组中的上皮过度角化，以及反弹猪中的淋巴滤泡。
Okay, this is difficult, but you know, this spindle cell is called kahal. In GI tract, there are kahal. Is related with the motility, peristaltic wave. So here you can see less numbers of the kahal in ISD group in comparison with the control and the rebound pigs.
至于免疫组化，您可以看到 IST 猪中的开轴间质细胞数量较少，而在对照组和反弹猪中较多。
Okay, and this is the one we have experienced. So we realized that there is a limitation to use device for patients. In animal, it was okay to use strings, but patients don't like that kind of strings. That's why AMC group developed a new idea. So here you can learn what they do to solve the problem. Every time if they have some problem, they try to make it. Also, they are my friend. They are my mentees. So they learned from myself, but they are doing still experimental studies. That's why if you are interested, we can do, because Dr. Yuenang is going to start. But Dr. Yuenang, you learned many things, right? So there is a limitation regarding the device. Dr. Yuenang, what did you learn and what do you want to do? If your grant is accepted, what are you going to do?
I think I'm going to load some drugs on the stent.
So again, why do you want to use drugs? You have to know the problem, the main problem related with the device now. As Dr. Chen Yao mentioned, the drug is not that good idea regarding to solve the problem. Now, hyperplasia is not a big deal. So you have to solve the problem of migration. If you do the same experimental study, you have the same result. So you have to do different approach. So what are you going to do? If you don't have any idea, you can discuss with our research members at the research meeting, which is very important. Anyway, we can solve the problem eventually. When we had some problem 10 years ago, we solved the problem. 100 years ago, other doctors, other scholars, they solved the problems. That's why it's a development, technological development. It's a kind of a continuous 薪火相传, same thing, okay? So anyway, I'd like to introduce the AMC group briefly because this is more difficult to understand. You know that photodynamic therapy is a minimally invasive approach that induces cell death using reactive oxygen species. So even though I am an interventional radiologist, I understand the basics because I have made a collaboration with the PhDs. That's why I understand this one. And we need to teach and learn from each other. The intracellular reactive oxygen species levels induced by accumulated photosensitized, laser, photosensitized. You use a laser, right? A lot. Why? Because it has lots of advantage. And then AMC group reported their experience with laser therapy. They devised just methylene blue. They're very simple. They coated the disc with the methylene blue. So methylene blue embedded ISD to treat obesity. Why methylene blue? Methylene blue is very cheap and you can use it. But when you use a laser, it can a better result.
如您所知，光动力疗法 PDT 是一种微创方法，通过产生活性氧化物诱导细胞死亡，由累积的光敏剂引发的细胞内活性氧化物水平引起氧化应激，导致细胞破坏。最近 AMC 团队报告了他们使用光动力甲基蓝嵌入 ISD 来治疗肥胖的经验。
So anyway, they placed the methylene blue embedded ISD in the peak, exactly like the same thing, but the disc part is coated with the methylene blue and followed by laser therapy here to enhance its effective and shorten the period of device implantation because of the migration rate. That's why
他们
this is a
开发了
very
这种技
interesting
术，以
idea.
增强其效果，并缩短设备置入的时间。他们在猪体内植入了嵌入甲基蓝的 ISD， 然后进行激光照射，然后他们在激光照射后立即移除了设备。
Probably Dr. Yuenang, you can use this technique. It's much better. Where is Dr. Yuenang? Okay. And then 5 peaks were used for IST group and 1 for control group. So 1 pig each for the highest group, sacrificed immediately 1, 2, and 4 weeks after laser therapy. And then you can see the result.
这些是光动力治疗后立即被处死的猪的照片。在这里，您可以看到盘部分位于胃贲门，并且由于光动力治疗而导致黏膜损伤和溃疡。
Okay, you can see this is a disc part, and then that is esophagus. This is from stomach, anterior wall, and both lateral wall and the posterior wall. You can see under the disc there is a mucosal injury and ulceration. That is immediately after photodynamic therapy.
这些是光动力治疗后立即被处死的猪的照片。在这里，您可以看到盘部分位于胃贲门，并且由于光动力治疗而导致黏膜损伤和溃疡。
These are microscopic images obtained immediately after 1 week, 2 weeks, and 4 weeks after laser treatment, showing the gradual recovery of the submucosal lymphoid follicular and epithelial hyperplasia.
这些是光动力治疗后立即1周、2周和4周后获得的纤维镜图像，显示了光动力治疗后的黏膜损伤、黏膜下淋巴滤泡和上皮增生，以及沿细胞紧润的逐渐恢复，从第1周到第4周。
And the total body weight gain is less in laser treatment group than the control group.
在接受光动力治疗的猪中，总体体重变化的百分比比对照猪低。第1周12%对24%，第2周28%对42%，第3周58%对78%，第4周81%对106%。
And also the plasma ghrelin level again was just lower at the first and second week and then normalized. There's also limitation.
与对照猪相比，光动力治疗后的猪在第1周和第2周的血浆胃饥饿素水平较低。
So Dr. Xu Shijun and Zhang Dongyang and Chen Yao, you know the limitation of the currently available ISD, right? So if Dr. Yuanang's grant proposal is accepted, everybody can do that together, right? That's why I chose this lecture for 2 reasons. One is that this is a 70% my experience, our experience, and 30% other experience. This is one example. The other is that as I am going to continue this research, if you want, this is also a good time to learn. And even though there is a limitation, if you have any idea, we can solve the problem. Dr. Shishijun, you understood, right? Okay. So anyway, this is a kind of a homework and also food for thought. You can think about different because obesity is a big problem in the world. If you have any device, minimally invasive treatment, that is a hard issue. It will be accepted by, if it is experimental study, it will be accepted by nature and science. If it is a clinical work, it will be accepted by Lancet. So this is a very popular topic, but there have a long way to go. But we can solve the problem if you want.
总之，在透视和内窥镜引导下 ，ISD 的植入在猪和啮齿动物模型中，在技术上是可行和安全的。ISD 似乎能够抑制幼年猪体重增加，但需要缝合或固定，似乎需要每隔2周进行重复的光动力治疗。 以保持长期有效性的减重和激素减少。